since you noticed some delay in people seeking help, were some of the complications that you saw a result of the delay in seeking care, or was appropriate care not given in a timely manner?
I think both. So that's a good question. I think that because we were not able to, see patients, telehealth was still kind of in its infancy. We were not able to even capture the right audience, if you may, or capture or have contact with a lot of people. People just went into this whole period of dormancy. And all of a sudden, I remember, March 15th coming on, and then our patient volume, which was, let's say, in the outpatient clinic, we're seeing 25 or 30 patients a day, was down to maybe 1 or 2 or 3 or 4 patients a day, because they were either so sick, or they were like, I have to see my doctor for one reason or another. But they were not coming in for forget about routine checks. They were not even coming in for serious blood pressure problems, for serious problems related to their heart disease, for that matter, and so on and so forth, to get an EKG with chest pain, for that matter. And yes, that's the outpatient setting. And we also saw a drop in the ER visits, and we saw a rise in myocardial infarction. We saw a simultaneous significant rise in heart disease that was catastrophic. And so in having privileges at one of the local hospitals, we saw that the patients who came in were sick to the point where they ended up getting cardiovascular catastrophe, shock, and those kinds of patients who were on these life-saving type of machines were basically being treated, rather than the common garden variety, generic myocardial infarctions or heart disease that we saw normally coming into the emergency room. And perhaps Rahul can shed light, because he sees it from the other side.
Yeah, I think I totally agree with and echo what Sam is saying. We see it from slightly different, but obviously coalescing perspective. We too, as a result of noticing that dip in referrals, patients coming in to see primary physicians, primary cardiologists, and therefore them not coming in to see us, but also the inpatients who are avoiding coming in. Now we're seeing it as kind of a surge of patients coming in who are waiting and can no longer wait or feel it's safe to come back. And what we're noticing is that their pathology is far more progressed than, say, they would have come in pre-COVID. And in some instances, that's okay. They're still in that window where it's appropriate to treat them and salvage. In unfortunate circumstances, it's too late. And I'll share a rather poignant and very contemporary example just that happened yesterday. I got a call from a referring physician from Santa Maria down south who was trying to transfer a patient that had a severe aortic stenosis, a narrowing of one of the valves that leads from the heart. Now, normally, once we identify that sort of pathology, the patient is referred in, they're seen by us, and we choose an appropriate treatment strategy. And we try and treat those patients very rapidly, because we know with that sort of a disease state, 50% of patients will die within 12 months untreated. So it's relatively urgent. Now, as a result of COVID, this patient was diagnosed. They elected to wait. They waited 6 months before returning to see their physician, who then suggested that they should be treated. They were discharged home, and they presented a week later in florid heart failure. Now, they were admitted as an inpatient. So now you fast forward 6-7 months, and that patient would have been treated as an outpatient in stable condition. They're now very sick. They're in hospital. They're on drips to keep their heart pumping. They're now calling us to transfer that patient very urgently in a helicopter. I brought the patient in. We transferred them. We took the patient to have a CT scan, which is necessary as part of the workup to put a new valve in a minimally invasive manner. And unfortunately, the patient actually had a cardiac arrest inside the CT scanner and died. Now, that's something that would have almost never happened pre-COVID, because that patient would have been seen, referred, and treated within a matter of months. And so I think that's something we see.
Delayed care.
Delayed care.